Hello, and welcome to this short video that provides an introduction to disparities in maternal health, some factors that contribute to these disparities, and what healthcare providers can do to start to address them. The maternal mortality rate is higher in the United States than in many other high-income, well-resourced countries, but not all pregnant and birthing people are equally impacted. Maternal health disparities, or the differences in pregnancy and birth outcomes based on race, ability, socioeconomic status, or geographic location, are an urgent issue that we must address. Each year, thousands of people in the United States experience life-threatening complications during the perinatal period, or the time frame from conception up to 2 years after birth. Some communities, though, are disproportionately affected by disparities in birth outcomes. For example, Black pregnant and birthing people are 3 to 4 times more likely to die from pregnancy-related causes, even when controlling for education and socioeconomic status. Indigenous pregnant and birthing people also experience significantly higher maternal mortality rates. In addition to race impacting disparities in maternal health and birth outcomes, birthers with lower incomes, those living in rural areas, people with apparent or non-apparent disabilities, those with less access to culturally responsive and inclusive, high-quality healthcare, or those experiencing domestic or sexual violence also face increased risk. We also know that conversations around domestic and sexual violence are often missed when discussing maternal health care, and the impacts of this violence on various communities are disproportionate as well. So, some communities are more heavily impacted by domestic and sexual violence, while also experiencing less access and more barriers to supportive services. The National Intimate Partner in Sexual Violence Survey found that 45% of Black women and 48% of Indigenous women reported physical violence, sexual violence, or stalking by an intimate partner in their lifetime, which is 20 to 25% higher than what white women have experienced. Experiencing violence compounds already existing disparities, and conversations with pregnant victims and survivors of domestic and sexual violence are often missed when discussing maternal health and birth outcomes. This is largely due to widely held social misunderstandings around domestic violence. Many people assume pregnant victims are protected from violence during pregnancy and birth because pregnancy is often thought of as a sacred or a protected time in a person's life. On the contrary, though, pregnancy and violence occur together at far higher rates than most people realize. Many survivors report that the abuse started, became worse, or became physical for the first time during pregnancy. Domestic violence is also associated with pregnancy because experiencing abuse increases the risk for unplanned pregnancies. This is called reproductive coercion. And victims often become pregnant because abusive partners may destroy or throw away their contraceptives, prevent them from using contraceptives, remove condoms without consent, or coerce their partners to become pregnant. Many victims also become pregnant from sexual assault. So, for healthcare providers, the likelihood that one of your patients is experiencing domestic or sexual violence is far higher than prior knowledge may have indicated. Pregnant people experiencing domestic violence may receive no or delayed prenatal care and are more at risk for depression, low birth weight, and preterm birth. Disparities in maternal health and birth outcomes result from multiple interconnected social factors, often referred to as social determinants of health. Structural racism, transphobia, heteronormativity, lack of access to high quality prenatal and postpartum care, and lack of affordable health insurance are a few examples of the social, rather than the biological, determinants of health, and these play a significant role in disparities. So let's break this down. Structural racism and implicit bias in many of our systems, including the healthcare system, can lead to unequal treatment of women of color, for example. Black and Indigenous women frequently report feeling dismissed, ignored, or having their pain not taken seriously by their provider. This may delay prenatal care or even delay life-saving support during birth. Implicit biases are the biases that all of us hold, yet we're not aware of them. They nonetheless contribute to the disparities in maternal health and in maternal mortality by impacting decision making and contributing to poor birth outcomes. Access to high quality, affordable health care also isn't equal. Pregnant people living in rural areas may not have reliable transportation or even have access to public transportation. They often have to travel long distances to see their healthcare provider. This might result in delayed or missed prenatal care. Pregnant people that are low income, uninsured, or underinsured may face financial barriers to quality care or difficulty finding a provider that accepts their insurance. These and many other barriers increase the likelihood of complications during pregnancy, childbirth, and during the postpartum period. Let's take a minute to talk about some of the other social factors that determine the quality of our health. Social determinants of health, such as stable and safe housing, quality education, gainful employment, safe and stable relationships that are free from violence, and access to nutritious food also contribute to disparities in maternal health and birth outcomes. Pregnant people who face stress from unstable housing, food insecurity, or domestic violence are at higher risk for many pregnancy complications and poor outcomes, such as low birth weight and preterm birth. While as healthcare providers, you don't have control over a lot of these factors, you can reduce the negative impact on patients by learning more about them and by becoming more aware of the unconscious biases related to them that you might hold. You can also increase positive birth outcomes by asking some routine questions to all of your patients, such as whether they're able to get to their appointment or if they have access to the food that they need, and by providing universal education on domestic and sexual violence to everyone. Please take a few minutes to view the video on the importance of universal education instead of or in addition to the routine screening questions for domestic violence that are typically asked. Social determinants are just as important as medical and biological factors in creating positive outcomes for patients. You may already be thinking that achieving the best possible outcomes for your patient goes beyond their medical chart. As advocates and healthcare providers, one of the most critical steps we can take to reduce disparities in maternal health is to address bias in the healthcare system. The first step in addressing this systemic bias is pretty simple. We must start by listening to clients and patients, believe their experiences, acknowledge their concerns, and take them seriously. Check in with them and make sure that they feel heard. It's important that all healthcare providers receive regular and ongoing training on implicit bias and how it unintentionally impacts the care provided and the outcome seen, especially for women of color. You or your administrator can contact the Michigan Coalition to End Domestic and Sexual Violence to access trainings on implicit bias, providing culturally responsive care, and reducing maternal health disparities. A better understanding of client or patient's cultural backgrounds and their previous experiences with the healthcare system can build trust and lead to better outcomes. Culturally responsive care is critical to reducing maternal health disparities. Thank you for taking the time to watch this short video on maternal health disparities. You can learn more about this and related topics at www.mcedsv.org. Click on the Maternal Health heading to access a wide variety of other recorded trainings, information on upcoming live trainings, and hundreds of other free resources. This video was developed with support from a grant from the Michigan Department of Health and Human Services, Michigan Maternal Mortality Surveillance Program. The opinions, findings, and conclusions or recommendations expressed in this video are those of the Michigan Coalition to End Domestic and Sexual Violence and do not necessarily reflect the view of the U.S. Department of Justice or the Michigan Department of Health and Human Services.